The winning laboratory has not merely met our standards, they have redefined them. They have shown us what it means to deliver excellence while maintaining operational efficiency and financial sustainability.
CCare Uganda, one of Uganda's leading private healthcare networks, has held its annual awards ceremony recognizing operational excellence in healthcare.
The top 3 nominees are
The event took place at Mestil Hotel, celebrating outstanding performance across CCare's network of facilities.
Winner is CCare Kitaka.
The ceremony, graced by Dr. Ronny Bahatungire, Commissioner Clinical Services, Minister of Health, and other dignitaries in the health sector. They emphasized CCare's dedication to elevating healthcare quality across Uganda.
Their commitment to continuous quality improvement and rigorous quality control protocols has resulted in reliable, precise results that doctors and patients can trust.
This year's awards recognize outstanding facilities across 9 categories, celebrating those that have implemented innovative strategies, systems, and tools to significantly enhance patient experience and operation excellency. Andrew Mugalu, General Manager of CCare IMC, stressed the significance of operation excellency, saying in professional healthcare, operation excellency, it's a culture, and they are building this culture to see that every patient interaction in the different facilities is meaningful.
We are continuously building this culture to make sure that every patient interaction is meaningful. Every day, you, our clinicians, our support staff are part of this journey that makes it possible for our patients to receive the right excellent healthcare that they are seeking for.
He added that since they met last year, a lot of changes have taken place, like growing from an average of 43,000 patients to an average of 50,000 people per month.
We have grown our network to 22 medical facilities across the country. 3 of our centers, Mokono, Mbale, and Gulu, transitioned to hospitals. 4,000 surgeries were done last year across all CCare facilities.
He adds that in order to save the environment, they decided to plant a tree for every baby who is born at the facility, and this project has been very successful.
1,800 babies were born within CCare facilities. Last year, we started a new surgical procedure, clipping of brain aneurysm at IHK. This is one of the procedures commonly referred out of the country. Last year, we installed Uganda's first AI-powered MRI machine, and we have gone on to add 4 new CT scans. In total, CCare operates 5 CT scans across the country.
Medical personnel from the different branches of CCare formed groups which entertained the guests with traditional dances. While appreciating the various stakeholders of CCare, Azal Sundol, CEO of CCare Uganda, shared that it's exactly 1 year ago since these awards were launched, and now they are reflecting on this journey from where they have come in terms of how CCare serves its patients.
So exactly 1 year ago, we launched the CCare Excellence Award. We asked ourselves, could excellence become our way of life at CKI. And today, after 12 months, we reflect on this journey from where we come from in terms of how we serve our patients, how we lead our team, and how do we build system that we can trust. We have become a place where excellence was something we would hope for. Today, excellence is embedded in the way we carry ourselves every day. With these awards, we have really seen, and I think people can feel it.
The awards span categories such as laboratory services, service excellence, facility operations, human resources, pharmacy, nursing protocols, billing and credit, and financial performance.
So, the winner is, guess what? CKI Parliamentary.
This year marks the second edition of the Excellency Awards, reinforcing CKI's commitment to promoting excellence and innovation across its network and inspiring staff to uphold the highest healthcare standards.
When we look at excellence, one wonders why, and especially in the area that we're in, which is medical. I was doing a quick research and discovered that Uganda spends about $70 million on medical tourism. That means that people leave Uganda to go outside the country for medical care. If you put it into Uganda shillings, that's about 255 billion shillings. That means it's about 700 million shillings every day is spent on medical tourism. And one wonders why. People go out because they're looking for excellence. People go out because they're looking to see, maybe I'll get a better chance out of it. So when CKI puts an emphasis on excellence, the key reasons why we do this is to make our contribution to ensure that other than actually spending all that money, we can actually spend it here.
CKI IFC.